Thank you, Lisa. It is an honor to stand in front of this room of 300 people of whom I've heard some of your stories. And this room is filled with people who've endured much suffering. And most importantly, this room is filled with people who have hope and a belief that we can do something. It happens so unexpectedly. A child down the street who required psychiatric hospitalization. The article in the local newspaper chronicling an adolescent suicide. The call from the school nurse that your daughter has had an acute anxiety attack and needs to be picked up at school. The star of your grandson's soccer team who is being sent to a residential school in Utah to address his difficult behavior. If this is happening to you or your friends, it is not an isolated set of circumstances. It is a growing and increasingly recognized phenomenon. We are experiencing an epidemic wave of adolescent mental health and substance use disorders. The patterns are beginning to emerge. In a national survey published in the journal Abnormal Psychology, rates of major depressive episodes in the last year increased 52% among adolescents aged 12 to 17 and 63% among young adults 16 to 25. Our state, California, had a higher than average percentage of adolescents reporting at least one major depressive episode in the past year. And in a related trend, an article from the journal Pediatrics described a 28% overall increase in psychiatric emergency department visits for children and young adults between 2011 and 2015. And then within these emergency department visits, there was a significant increase in suicide-related visits. But the most worrisome part about this article told us that only 16% of those emergency visits resulted in follow-up by a mental health provider. We are in the presence of an epidemic rising around us, and kids are not being reached early enough or with sufficient treatment resources to stem this epidemic. This adolescent behavioral health epidemic will require a new response that will call on all of us, parents, neighbors, schools, corporations, faith-based organizations, youth organizations, social media platforms, and elected officials. We need all of them if we're going to prevent it from causing increasing harm. To begin with addressing the clinical needs of our kids, we have really big challenges. Put succinctly, not enough kids are being treated who have mental health disorders and substance use disorders. In our state, where approximately 13% of youth 12 to 17 report suffering from a major depressive episode, 65 of those youth with a clinically defined major depressive episode did not receive any treatment at all. Major depressive episode, no treatment. And of those who did, only 24 got consistent treatment. Not only does this cause unnecessary suffering among our children, we know that untreated, persistent, or serious mental illness in children usually does not pass. I'm emphasizing serious. Most serious mental health disorders untreated in youth go on to become serious mental illness in adulthood. Moreover, studies showed that more than 90% of adults coping with addiction began in adolescence. And we all know with the growing presence of vaping and the legalization of marijuana, substance use among young people is only increasing. In ranking upon ranking, California routinely ranks in the bottom third of American states that provides adequate access and treatment for our youth and young adults. And to me, that's astounding. I think of us as being so health-focused and so comfortable talking about mental health issues. And yet we as a state are really failing our young people. But here in Silicon Valley, we have the resources, we have the research institutions, we have the innovation and the ingenuity to reimagine a more comprehensive response. Caminar has been, with others, bringing this epidemic to the community's attention for a while now. 2 years ago, in coordination with Dr. Stephen Adelsheim of Stanford University, we educated the community on the dangers of unaddressed mental health disorders among youth. Dr. Adelsheim, at that very critical meeting 2 years ago, made a plea for a youth-supportive public mental health system. Much is being done in our community to fashion a response, and I just want to name a few. I want to call out the good work of Project Safety Net in Palo Alto, which it's been created as a community-wide response to prevent adolescent suicide. Also in our area, Sequoia Healthcare District has taken a leadership role in working with elementary, middle, and high schools to work upstream on prevention and early intervention. We at Caminar appreciate all of our school and school district partners who are here for their commitment to supporting the health and well-being of students. Yet even with all of this good work, there remains a dangerous gap these great efforts cannot completely address yet. A good bit of research is currently being carried out to understand the causes behind this epidemic. As with all epidemics, we need to get ahead of it and address what is causing our children to be in such distress, and not just treat it when it manifests itself as mental illness. A review of the literature points in a number of inconclusive directions about potential contributors, in particular to suicidal behavior. Those are cannabis and other illicit drug use, parents who are distracted and not able to maintain a close emotional connection with their children, and a set of issues around the effects of screen time on sleep and neurological development. Clinical services provided when symptoms first appear is a critical step. Acting even earlier to build protective factors to prevent symptoms from developing is more important. In Silicon Valley, through our Family and Children's Services Division, we partner with elementary, middle, and high schools with on-campus counseling services addressing bullying, depression, anxiety, stress, and home life issues. For more than 25 years, we have been providing the evidence-based FAST Together in Santa Clara County. This program is a comprehensive program that works with parents and children to improve social emotional learning, so critical in the preteen years, improves relationships between parents and kids, and substantially reduces symptoms of emotional disturbance among children. In addition, the program helps parents to understand the negative effects of alcohol, tobacco, and other drugs, and improves, and David will be talking about this, I'm sure, improves the ability of parents to recognize early use and improves their knowledge about how to get help for their children. The good news is that many evidence-based interventions exist to address this epidemic. The bad news is that our community has a shortage of trained behavioral health workers, especially of bilingual professionals, and insufficient funding to scale up the behavioral health delivery system. In fact, a recent article in the Stanford Social Innovation Review last month, titled "The Crisis of Youth Mental Health," describes this treatment gap. The author outlines the drop in philanthropic funding for child mental health. We need more public and private funding to scale up a sufficient treatment response to counteract this epidemic display of symptoms. But like most epidemics, treatment comes at the end of a process of contributing factors that may have been prevented earlier, and thereby reducing the toll of suffering among our kids and families. Prevention starts at home and in school, and preferably before the beginning of the teenage years. One of the greatest protective factors a child has is a sympathetic caregiver. It doesn't need to be a parent, it can be a teacher, it can be an aunt, it can be a big brother, who can help that child understand their own feelings and buffer that child's exposure to adverse experiences that cause emotional distress. So what can we do? I'm highlighting these large policy and funding and treatment gaps. What can we do to create homes and schools and communities where mental wellness is valued, discussed, and practiced? It starts really by normalizing talking about difficult emotions and feelings such as stress, grief, or loss with children in particular, but also with other adults. I would suggest you consider reducing or eliminating. I know there can be wars in households over this. I had to deal with this with kids I helped to raise. But consider reducing or eliminating screen time for your children's use at night to improve the quality of sleep and to extend the duration of the time that they might be asleep. And this, by the way, is beneficial for all ages. Dedicate a weekly meal where everyone is encouraged to share something about their day, where the sharing of emotional experiences is learned and observed by children. I ask you to talk about mental health and how it affects your family with community leaders and elected officials. And I ask that we all work to end the stigma of silence by being forthcoming about our own struggles and success with your own mental health. You can be an example of resilience for your children and your peers. And of course, reach out for help. Consult your pediatrician, a doctor, a psychologist, or call us to get help. In addition to these steps in accessing good clinical care earlier, we need bold solutions. Everyone in this room can play a lead role in turning the situation around. At Caminar, we will be commencing a strategic planning process that will put this epidemic at the heart of our work. Let the word go forth from here on this beautiful spring day that we all of us in this room, commit to clearing danger from our children's horizons. If we can't create this change in the Bay Area, where we have the deep commitment to philanthropy, world-class research institutions, a drive for innovation, and renowned experts, who else is going to be able to do this? Our children, our families, our communities deserve no less. Thank you.